What are the limits of X-rays in diagnosing osteoarthritis? Imagine trying to see a puzzle piece that is hidden behind a curtain. That's similar to what X-ray imaging can do when it comes to osteoarthritis. X-rays are often used to look at joints, but they have some important limits. Osteoarthritis is a condition where the cartilage in a joint wears down over time, causing pain, stiffness, and changes in the bones. X-rays can show some of these changes, but they don't tell the whole story. One big limit is that X-rays only show bones. They don't reveal soft tissues like cartilage, ligaments, or early signs of inflammation. Cartilage is the smooth tissue that covers the ends of bones in a joint. When it wears down in osteoarthritis, the space between the bones narrows. But since cartilage doesn't show up on X-rays, doctors have to estimate how much cartilage is lost by looking at the space between bones. If the space looks narrow, it suggests cartilage loss, but it doesn't tell how much cartilage is left or how healthy it still is. Another challenge is that X-rays may not catch early osteoarthritis. In the beginning stages, the changes in the joint are often too small to see on an X-ray. Someone might have pain, stiffness, or other symptoms, but their X-ray could look normal. This means a normal X-ray doesn't rule out osteoarthritis. It's possible to have symptoms but no visible signs on the imaging. X-rays can sometimes overestimate or underestimate how severe the osteoarthritis is. For example, a person might have intense pain but only mild changes on the X-ray. Conversely, someone might have major joint changes on the X-ray but feel little to no pain. This mismatch makes it tricky to relying solely on X-ray results for treatment decisions. Monitoring how osteoarthritis progresses over time is also difficult with X-rays. Changes in the joint happen slowly, and small differences between X-rays taken months or years apart can be hard to see. This makes it tough to track how fast the disease is getting worse. X-rays are useful for ruling out other problems, like fractures or infections, that can cause joint pain. But for diagnosing osteoarthritis, a doctor will usually combine the X-ray with a physical exam, medical history, and symptoms. Sometimes, other imaging tests like magnetic resonance imaging or ultrasound are needed to get a clearer picture of what's happening inside the joint. In summary, X-ray imaging can show some signs of osteoarthritis, like joint space narrowing, bone spurs, and changes in bone density. But it has important limits. It doesn't show cartilage or early changes, can misrepresent how bad the disease really is, and isn't always reliable for tracking progress. That's why doctors use X-rays as just one part of the overall diagnosis process, along with other tests and clinical information.